Fatty liver disease, also known as hepatic steatosis, is a condition characterized by the accumulation of fat in the liver cells. This buildup of fat can lead to liver inflammation and damage over time, potentially progressing to more severe conditions such as non-alcoholic fatty liver disease, NAFLD, or non-alcoholic steatohepatitis (NASH). There are two main types of fatty liver disease: alcoholic fatty liver disease and non-alcoholic fatty liver disease. Alcoholic fatty liver disease is caused by excessive alcohol consumption, while non-alcoholic fatty liver disease is associated with factors such as obesity, insulin resistance, high blood sugar, high levels of fats in the blood, and metabolic syndrome. Non-alcoholic fatty liver disease is becoming increasingly prevalent, particularly in developed countries, due to the rising rates of obesity and type 2 diabetes. The liver plays a crucial role in various metabolic processes, including the breakdown of fats, regulation of blood sugar levels, and detoxification of harmful substances. When there is an excessive accumulation of fat in the liver, it can impair its ability to function properly. Causes of fatty liver disease. 1. Obesity and poor diet. One of the leading causes of fatty liver disease is obesity, particularly visceral adiposity, where fat accumulates around the abdomen. This excess fat can infiltrate the liver, leading to fatty liver disease. Poor dietary habits, such as excessive consumption of high-calorie, high-fat foods and sugary beverages, contribute significantly to obesity and the development of fatty liver disease. 2. Insulin resistance and metabolic syndrome. Insulin resistance, a condition in which cells become less responsive to insulin, is strongly associated with the development of fatty liver disease. When cells fail to respond to insulin properly, the body produces more insulin to maintain normal blood sugar levels. Elevated insulin levels promote the accumulation of fat in the liver, leading to fatty liver disease. Insulin resistance often coexists with other metabolic abnormalities, collectively known as metabolic syndrome, which includes obesity, high blood pressure, and abnormal lipid levels. 3. Type 2 diabetes. Individuals with type 2 diabetes are at increased risk of developing fatty liver disease. Insulin resistance, a hallmark of type 2 diabetes, plays a central role in the pathogenesis of fatty liver disease. Moreover, high blood sugar levels in diabetes can directly contribute to liver damage and exacerbate existing liver fat accumulation. 4. Alcohol consumption. Excessive alcohol consumption is a well-known cause of fatty liver disease, known as alcoholic fatty liver disease, AFLD. Alcohol is metabolized in the liver, and chronic alcohol consumption can overwhelm the liver's capacity to process it, leading to fat accumulation and inflammation. AFLD ranges from simple fatty liver to more severe conditions such as alcoholic hepatitis and cirrhosis. 5. Genetics. Genetic factors play a role in predisposing individuals to fatty liver disease. Certain genetic variations can influence how the body metabolizes fat and processes toxins, affecting the risk of developing liver disease. For example, variations in genes involved in lipid metabolism and insulin signaling pathways can increase susceptibility to fatty liver disease. 6. Rapid weight loss. While obesity contributes to the development of fatty liver disease, rapid weight loss, especially through crash diets or bariatric surgery, can also trigger liver fat accumulation. When the body undergoes rapid weight loss, fat stores are mobilized, releasing fatty acids into the bloodstream. If the liver's capacity to metabolize these fatty acids is exceeded, they can accumulate in the liver, leading to fatty liver disease. 7. Medications and toxins. Certain medications and environmental toxins can contribute to the development of fatty liver disease. Examples include corticosteroids, tamoxifen, methotrexate, and environmental pollutants such as pesticides and industrial chemicals. These substances can directly damage liver cells or disrupt normal liver function, leading to fat accumulation and inflammation. 8. Nutritional factors. In addition to excessive calorie intake, Certain dietary factors can influence the risk of fatty liver disease. Diets high in fructose, found in sweetened beverages and processed foods, have been linked to increased liver fat accumulation. Fructose metabolism in the liver can promote lipogenesis and contribute to insulin resistance, both of which are key drivers of fatty liver disease. 9. Sedentary lifestyle. Lack of physical activity is closely associated with obesity and metabolic dysfunction, both of which are risk factors for fatty liver disease. Regular exercise helps improve insulin sensitivity, promote weight loss, and reduce liver fat accumulation. Sedentary behavior, on the other hand, contributes to a dysregulated metabolism and increased susceptibility to fatty liver disease. 10. Other medical conditions. Certain medical conditions, such as polycystic ovary syndrome (PCOS), hypothyroidism, and obstructive sleep apnea, are associated with an increased risk of fatty liver disease. These conditions often coexist with obesity, insulin resistance, or hormonal imbalances, contributing to liver fat accumulation through various mechanisms. 10 signs of fatty liver disease. 1. Right shoulder pain, a common indicator. One of the lesser-known symptoms of fatty liver disease is right shoulder pain. This discomfort often manifests as a dull ache or sharp pain in the upper right quadrant of the abdomen, beneath the ribcage. While it may seem unrelated to liver health, the connection lies in the proximity of the liver to the diaphragm and surrounding structures. The liver, positioned in the upper right abdomen, is nestled beneath the diaphragm. When the liver becomes enlarged due to fat accumulation, it can exert pressure on the diaphragm, leading to referred pain in the right shoulder. This phenomenon, known as referred pain, occurs when pain is felt in a different location from its source. Furthermore, fatty liver disease can cause inflammation and stretching of the liver capsule, which is rich in nerves. This inflammation can contribute to the sensation of pain, further exacerbating discomfort in the right shoulder region. Therefore, individuals experiencing persistent right shoulder pain should consider it as a potential symptom of fatty liver disease and seek medical evaluation promptly. 2. Abdominal fat, a visible clue. Excessive abdominal fat, particularly visceral fat, is closely linked to the development and progression of fatty liver disease. Visceral fat accumulates around the organs in the abdominal cavity, including the liver, and is metabolically active, releasing substances that can contribute to insulin resistance, inflammation, and liver dysfunction. Individuals with fatty liver disease often exhibit central obesity, characterized by an increased waist circumference or a high waist-to-hip ratio. This pattern of fat distribution is associated with a higher risk of metabolic syndrome, type 2 diabetes, and cardiovascular disease, all of which are interconnected with fatty liver disease. Moreover, abdominal adiposity is a visible clue that can alert individuals and healthcare professionals to the presence of underlying metabolic disturbances, including fatty liver disease. Monitoring changes in waist circumference and body composition can aid in the early detection and management of this condition, emphasizing the importance of lifestyle modifications such as regular exercise and a balanced diet. 3. Spider veins and external manifestation. Spider veins, medically known as telangiectasia, are small dilated blood vessels that appear close to the surface of the skin, resembling spider webs or tree branches. While they are commonly associated with venous insufficiency and varicose veins, their presence can also serve as a sign of underlying liver dysfunction, including fatty liver disease. The relationship between spider veins and fatty liver disease lies in the intricate interplay between circulatory disturbances, inflammation, and vascular health. In individuals with fatty liver disease, impaired liver function can lead to alterations in the production and clearance of certain proteins and hormones, contributing to vasodilation and the formation of spider veins. Furthermore, chronic inflammation and oxidative stress, hallmark features of fatty liver disease, can damage blood vessels and impair endothelial function, promoting the development of telangiectasia. Consequently, individuals with spider veins, particularly when accompanied by other signs or symptoms suggestive of metabolic dysfunction, should undergo thorough evaluation for underlying liver pathology. 4. High cholesterol levels. Elevated cholesterol levels, specifically increased levels of low-density lipoprotein (LDL) cholesterol, are commonly associated with fatty liver disease. The liver plays a vital role in lipid metabolism, including the synthesis, storage, and transportation of cholesterol. However, in individuals with fatty liver disease, impaired liver function leads to dysregulation of lipid metabolism, resulting in elevated cholesterol levels. Cholesterol is essential for various physiological processes, including the formation of cell membranes and the synthesis of hormones. However, excessive cholesterol accumulation in the liver can contribute to the progression of fatty liver disease and increase the risk of cardiovascular complications, such as heart disease and stroke. Monitoring cholesterol levels through blood tests can help identify individuals at risk of fatty liver disease and guide appropriate management strategies. Lifestyle modifications, including a healthy diet, regular exercise, and weight management, are essential for reducing cholesterol levels and improving liver health. 5. Low thyroid function. Thyroid hormones play a crucial role in regulating metabolism, including lipid metabolism. Thyroid hormones, particularly thyroxine T4 and triiodothyronine T3, influence the activity of enzymes involved in lipid synthesis, breakdown, and transport. Therefore, alterations in thyroid function can impact lipid metabolism and contribute to the development of fatty liver disease. Low thyroid function, also known as hypothyroidism, is characterized by insufficient production of thyroid hormones by the thyroid gland. Hypothyroidism is associated with various metabolic disturbances, including dyslipidemia, insulin resistance, and weight gain, all of which are risk factors for fatty liver disease. Individuals with hypothyroidism may experience symptoms such as fatigue, weight gain, constipation, and dry skin, which can overlap with manifestations of fatty liver disease. 6. Visceral fat accumulation. Visceral fat refers to fat that accumulates around the abdominal organs, including the liver. Excessive visceral fat is a hallmark of obesity and metabolic syndrome, both of which are closely linked to fatty liver disease. Individuals with a large waist circumference or a high waist-to-hip ratio are more likely to have significant visceral fat accumulation. This excess fat can infiltrate the liver tissue, leading to inflammation and liver dysfunction. Visibly, individuals with fatty liver disease may have a protruding abdomen or a beer belly appearance, even if they do not consume alcohol excessively. However, it's essential to note that not everyone with fatty liver disease will exhibit outward signs of abdominal obesity, as the condition can also affect individuals with normal body weight. 7. Elevated liver enzymes. Liver enzymes are proteins produced by the liver that play a vital role in various metabolic processes. When liver cells are damaged or inflamed, they release these enzymes into the bloodstream, leading to elevated levels detected through blood tests. The two primary liver enzymes measured in routine blood tests are alanine aminotransferase (ALT) and aspartate aminotransferase (AST). Elevated levels of ALT, in particular, are commonly associated with liver injury and are often used as a marker for liver diseases such as fatty liver disease. However, it's essential to interpret liver enzyme levels in conjunction with other clinical findings, as elevated liver enzymes can also occur due to other factors such as alcohol consumption, viral hepatitis, medications, or muscle injury. 8. Peripheral edema. Peripheral edema refers to the accumulation of fluid in the extremities, typically causing swelling in the ankles, feet, and legs. While peripheral edema can have various underlying causes, including heart failure, kidney disease, and venous insufficiency, it can also occur in individuals with advanced fatty liver disease. Liver dysfunction can lead to changes in the body's fluid balance, resulting in fluid retention and swelling in the lower limbs. Additionally, as liver disease progresses, it can impair the production of proteins such as albumin, which helps maintain fluid balance in the body. Consequently, decreased albumin levels can contribute to the development of peripheral edema. 9. Constant fatigue. Chronic fatigue is a common complaint among individuals with fatty liver disease. The underlying mechanisms contributing to fatigue in liver disease are multifactorial and may include metabolic disturbances, inflammation, hormonal imbalances, and sleep disturbances. As the liver becomes increasingly inflamed and damaged due to fat accumulation, its ability to perform essential functions such as filtering toxins, metabolizing nutrients, and producing energy may be compromised. This can result in feelings of persistent fatigue, weakness, and reduced stamina, impacting daily activities and quality of life. Moreover, individuals with fatty liver disease may experience disrupted sleep patterns due to discomfort from abdominal distension or other symptoms, further exacerbating fatigue. 10. Enlarged liver, hepatomegaly. Hepatomegaly, or an enlarged liver, serves as a prominent indicator of fatty liver disease, a condition characterized by the accumulation of fat in liver cells. This disorder, encompassing both alcoholic fatty liver disease, AFLD, and non-alcoholic fatty liver disease, NAFLD, has emerged as a significant public health concern globally, closely associated with obesity, diabetes, and metabolic syndrome.